І я почав нашу програму в Рочестері в 2009 році, і тоді я перенісся тут до Філадельфії. Це вже мій 5-й рік, що я тут. І це все про мене.
Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. Well, it's great to have everyone joining us today for this episode of All Things Cardio-Oncology. One of the great privileges we have is to explore the global intersection of heart health and cancer care. And as usual, I want to welcome my co-hosts Dan Lenahan and Arjun Ghosh. And in today's episode, we have the honor of speaking with leaders from our International Cardio-Oncology Society chapter in the Ukraine, Sergei Kozhukov, who is president of the Ukrainian chapter, and his colleague, Nataliia Dovganych. And we are also joined by a Ukrainian-American, Eugene Storozynsky, and that really challenged me to say all those names. He is professor of medicine and oncology and chief of cardio-oncology at the Thomas Jefferson University Hospital in Philadelphia. Eugene recently visited Ukraine and delivered a lecture there on cardio-oncology. And in our last check-in with our team from Ukraine, which was all the way back in 2022, we got an update from them, obviously, on the difficulties that they are facing in the current situation with the war there. And so maybe Eugene or Nataliia and Sergei, maybe you could just kind of provide us with an update, given the current humanitarian situation, the conflict. How is that impacting your ongoing work in cardio-oncology?
Really now in Ukraine, difficult time, but I think today, especially tomorrow, is meeting point for changing, because planning a meeting on Alaska with President of the United States, Donald Trump, and we believe that situation will be changed significantly, and we wait for this point. But if we talk about clinical practice and science, about science, now we have no any financial support for research, but in our cardio-oncology center, we perform some clinical study, and we recently published 2 articles in the review in cardiovascular medicine and about thrombosis in cancer patient, and now we prepare article in another journal, and of course we visit in cardio-oncology conference, European Society of Cardiology, and present our new data about significance of troponin. I think the Nataliia that responsible for this project in detail to support this our scientific work. Please, Nataliia.
Thank you. I will clarify a situation because yes, the situation is difficult, and I can say that in 2022, when the military conflict began, so many patients and many people, they go abroad because of the situation, and really medical care was difficult for many of them. But what we can say about nowadays, I see that main hospitals and main clinic in Ukraine, they are situated not so close to the zone of the conflict. They are working in their regular regimes, and what we can say about our institution and Kyiv. So of course, there is sometimes very hard situation, especially in the nights when we have and blowing. But many of us try to do our best, and we are working as usual, but with these hard circumstances. Many consultations we provide in online manner, because there is no sometimes possibility for patients to reach the hospitals, and it is very suitable for doctors too when we can connect with them. And what I can say about cancer medical aid in Ukraine, patients with cancer are usually managed in a cancer center. They receive all necessary aid, surgery, radiation, chemotherapy. So with this point, it's okay. But when the patients have cardiovascular disorders, these patients referred to cardiologists, and our main goal for this Cardio-Oncology Center was to help oncologists to provide cancer treatment in the whole scale. And I think that we have a success, because for this years from 2016, as Sergey told about this, we really developed a good connection with different cancer centers. And now oncologists, hematologists understand that this is very important. And I think that this is very necessary. This is very necessary discipline, and I think that many cardiologists want to be like cardio-oncologists, but of course they need additional learning and additional course. So I think that this will be very necessary for Ukraine.
Steve and colleagues, I would like to remember that 3 years ago, Steve called to me and asked to present current situation with oncology, with oncology consulting and the situation in general in Ukraine. And by support ICOS, World Health Organization, ASCO, and ESMO, we organized first conference during Europe. And the main message was how we can support cancer treatment for patients in Ukraine and for patients that move to Europe and to another country. And this meeting was on every month, and we all time analyze situation in Ukraine and abroad, and all organizations support with cancer treatment, hospitalization, and of course evacuation. And I thanks Steve that you 3 years ago to ask me, and I monitor a situation across country in all region, and of course this was very important for Ukraine and for oncology patients.
I'm so glad that was helpful, and we just continue to marvel at the work you're doing. Dan?
Yes, so I had the blessing to visit Eugene, where he works in Philadelphia, and I found out that he had just traveled to Ukraine and saw firsthand what was going on there. So, and I think it really sounded to me like it was quite impressive what you're able to do in Ukraine. So, Eugene, I don't know if you want to give us a personal account of what happened there.
Or no, thank you, Dan. And Steve, thank you so much for inviting me to this webinar. and Sergey and Nataliia, it was very nice to meet you. I didn't realize how active the chapter is in Ukraine, and I'm really, to be honest, quite embarrassed about that. That I didn't realize the great work that my Ukrainian counterparts and colleagues are doing in this time. So I went to Ukraine. I was invited by Dr. Boris Todorov, who I mentioned to Sergey and to Nataliia. Dr. Todorov is a heart transplant surgeon, and he, at the end of May 28th, I believe, that Saturday, he had a conference that he had organized and that his Institute of the Heart, Institut Sercya Moz, as it's called in Ukrainian, had organized, and it was called Contemporary Cardiology 2025. And during this conference, which was held at the Intercontinental Hotel in Kyiv, and it was held in their ballroom, which also serves as a bomb shelter because it's underground. There were approximately 600 cardiologists, nurse practitioners, and other physicians from throughout Ukraine that came in order to learn about contemporary cardiology as it's happening not just in Ukraine, but as it's happening internationally. And it was a great conference. And I was asked, even though I'm a transplant cardiologist here in the States, and I am the enterprise chief of Cardio-Oncology in Philadelphia, I was asked not to give a talk about transplant cardiology, but I was asked to give a talk about cardio-oncology from the American perspective, from the United States perspective. And it was really a great meeting. I was in awe of everything contemporary that was being done, not only at the Institute, but there were invited speakers from Kharkiv, from Lviv, from other regions throughout Ukraine that came, Kherson, Odessa, that gave talks about, contemporary cardiovascular, topics. And it was a great meeting. And right after the meeting, or just before the meeting, the friends that I had met previously who work at the Institute, took me around Kyiv and just showed me some of the devastation that's been occurring in Kyiv. They took me to Irpin, and I saw firsthand the devastation that's been happening in Ukraine. But I also saw the resilience of Ukrainians. Not only the general population, but clearly the physicians, right? Knowing that under these wartime conditions, they're still, taking care of their patients and taking care of them with the highest level of knowledge and sophistication that I would say really rivals Europe and rivals America, considering the limitations that war, brings, right? And so I was really enamored by that. I was inspired by that. And that's really what brought about this webinar, after my discussions with Dan, and then with Steve. And I'm just so thankful to be able to participate in this webinar, because I think that this is something that I hope that we'll be able to maintain on a regular basis, because there are definitely, ideas and considerations, and most importantly, things that we can bring to our patients across, the borders that would help our patients, to continue to receive their cancer treatments, but also, protecting and maintaining overall cardiovascular health.
So, Arjun, I know that, we've done a variety of podcasts over time, and each time we, sort of go to a different part of the world and you kind of hear what's happening there. I'm so impressed by, people's, enthusiasm and ingenuity and persistence and diligence and all these really great characteristics. And hearing about it, in person with Eugene, what his perspective was in Ukraine, and then of course Sergey and Nataliia, what you just told us about. I mean, Arjun, how do you put all this together? What do you hear from your perspective in the UK?
Yeah, no, thanks, Dan. I mean, I was just thinking before we started, mentioned to Sergey that it's been quite some time that we met, and we actually met the first time before the war. So, quite some time ago, and a lot has obviously kind of happened since. And I think, would have been very difficult to predict, what was going to happen at that time. And as you say, it's just very amazing how Sergey, Natalie, and colleagues have managed to, keep going under these circumstances and actually, have a very kind of flourishing and thriving, cardio-oncology society and, collaborations. I mean, I guess one of the questions that I might have for Natalia and Sergey is, how have you managed to keep, the spirit of, cardio-oncology going in Ukraine under these circumstances? Because I'm sure this is something that we could all learn to, increase enthusiasm in our countries as well.
Thank you, Arjun. First of all, I would like to talk about close collaboration because it's very important with cardiologists and oncologists, hematologists. And a few years ago, we performed Ukrainian national survey and published in JACC Cardio-Oncology. And we thinking about how to investigate the awareness in the management of cancer patients with cardiovascular disease and cardiovascular complications among doctors of different specialties in real clinical practice, and to understand gap in the knowledge. And my task was how we can prepare special courses for different doctors, and we start 3 level of education. First level for cardiologists who not involved in management cancer patient. Second level cardiologists who consult cardio-oncology patient, risk stratification, prevention, monitoring during treatment, and management of concomitant cardiovascular disease. And of course, main attention to third level cardiologists of cardio-oncology center or cardiologists in oncology clinics, full range of knowledge in cardio-oncology. And every year we have a Congress of Cardiology and one day special session cardio-oncology. We have separate cardio-oncology conference, and every month we have some cardio-oncology conference in different region. And sometimes we go through country and visited famous oncology centers, and in each center we prepare small conference with our colleagues and have time to communicate how we can working together, how we can manage patient with cancer, with cardiovascular disease, and with cardiovascular complication. Of course, our centers consult patients across Ukraine, and of course, patient with severe heart failure or another complication with acute myocardial infarction, with written disturbances that need gas lab or electrophysiology laboratory. We have all these things in our center, and we enable to care about cancer patient with different complications. And of course, we have online consulting, not only with patients, but with doctors. And sometimes it is quite difficult decision how we can manage those patients. And in general, we have good communication with oncologists, with hemotherapists, with hematologist, and of course with other specialties that involve in management cancer patients.
And I want to add about our practice, daily practice. So, as Eugene said, if in case of emergency, yes, in our hospitals there is a shelter, and we with the patients go to this shelter, and of course we understand that we are responsible not only for the management but also for the life of our patients. And I think that in this hard situation we became stronger. And I think that now we realize that our life is the highest value. And first of all, I want to notice about the development of oncology treatment in Ukraine. So I am working close with oncohematologist, and I can say that in Ukraine, this oncohematology is rapidly developed, and there are a special oncohematologist department, and we have in Ukraine approximately 11 centers that provided a stem cell transplant, autologous and allogenic transplantation for patients with lymphoma, multiple myeloma, amyloidosis. And I think that every year the number of patients who receive such kind of treatment become higher. And of course, they understand that for this group of patients, cardio-oncologist is in great need. And we have now a recommendation of EAC 2022, where we can see the recommendation for those patients who receive stem cell transplant, who receive ICR management, and other novel therapies. So I think that these recommendations are very useful for us and oncologists and hematologists too.
So one thing I would wonder, how can we, sort of as an international community, or especially if we have, very committed colleagues like Eugene, how can we help you, or what can we do to, address whatever you think is the best way to deal with your current constraints and how to optimize, whatever care you can provide for your patients? How can we help?
So first of all, I want so I'm grateful for Daniel Lenihan and for Steve that you support us from ICOS, because maybe you remember that you participated in our cardio-oncology section during Cardio-Oncology Congress 2 years ago. And I think that it's very, for us, important, because Ukraine needs really support in knowledge, support in popularization of this cardio-oncology specialty. And I think that me and Sergey, we participated in different oncology and oncohematology congresses and conferences. So maybe there is a need to performing more wide among these specialties, I think.
I would like to add that by support ICOS, we organize a joint session during our cardio-oncology event, and we invite world-class speaker like Denihan a few years ago, and speakers from Europe, and our doctors very interested in this session. And of course, we take part in every year in European Society Congress of Cardiology, previously in GCOS, Global Cardio-Oncology, summit, and this year we planning to take part in European Society Cardiology Congress by Chia, and my topic is amyloidosis and heart failure in patient with cancer.
So, Eugene, how do you think we can help? Since your perspective obviously would be you have significant personal interest, but also you're based in the U.S. How do you think we can be helpful?
I mean, I think one of the ways certainly is if there are multi-center clinical trials, and if it was possible to bring on centers from Ukraine, from Kyiv, that would be fantastic, right? To be able to develop, to ensure that interventions that are being recommended are not only good for, a certain population, but that it is much more interpretable throughout a disease entity rather than a patient-specific intervention. So I think that something like that would be fantastic. We know from prior history that, and if I could take a step back, from a historical standpoint, Ukraine has always been a bedrock of innovation, of ideas, of literature for Europe. It's a European country. It's never considered itself to be, a under the sphere of Russia, which unfortunately it's big neighbor to the east. But Ukraine is always, always, sided with Europe. And as a European country, its goal has always been improvement, right? And I think that, by really formulating these international collaborations with institutions, physicians, in Ukraine, that's going to be a win-win, not just for for Ukraine, but also for us here in America, because these are strong collaborations that we can not only initiate, but we'll be able to really develop and maintain over time.
Thank you, Eugene, that you talk about clinical trials. And my department, as clinical pharmacology department, have big experience in clinical trials, in international trial and local trial. And our task is prepare clinical trials from ideas up to randomized multi-center trials in Ukraine. As an example, I would like to talk about one trial in patient with acute myocardial infarction with stenting, with PCI, with MRI, with speckle tracking echocardiography that we present as oral presentation during ESC Cardiology Congress and recently published in one cardiology journal. Of course, we interested in clinical trials, not only in cardio-oncology, but in general cardiology. And of course, we have experience in grants, European grants, Horizon 22, 22, 20, and now we have one grants with European Institute of Oncology, Milan, and now we in progress with prepare new proposal for grants, but we also interested in collaboration, not only in clinical trials, but also in grants. Thank you.
I think that that's a great idea. And I think that that would be something that would further elevate, the status of cardio-oncology, again, not just here in America, but in Europe and certainly in Ukraine by formulating these very strong collaborations.
I want also added that now we participated in grant about mental health in cancer patients. It's very important topic, I think, and our country participate, but I think that maybe such a grant can be international, not only European, because really the tools that will be provided for these patients, maybe AI, something tools, I don't know, but I think that as we know, we understand that the cancer patients and they have really mental disorders, and this is very important to their treatment and the circumstances of their treatment. So maybe it will be, if you have some ideas about this international collaboration, so I think we can be involved because we have an experience about this.
I think, Nataliia, what you mentioned is so key, right? So there was this idea that came about in the late 1970s, early 80s that was called BPSM, and that stands for biopsychosocial medicine. What that means is that you can never just focus on the biologic component of a person's overall well-being without also taking into account their mental well-being and their social well-being, because you're never going to be able to treat them appropriately and get them into, recovery, whatever recovery that is, right? Cancer remission, heart failure remission, whatever the case may be. And I think these are extremely important topics. And we know certainly that patients that develop heart failure are at a much higher risk of developing depression and other psychological, illnesses, or maybe they had a predisposition for those psychological illnesses, but once they developed their biological illness, cancer, heart failure, heart disease, that really brought to the forefront their psychological illnesses. And unless those things are adequately identified and intervened upon, there's really a very low likelihood that you're going to be successful in treating the whole person, right? And trying to get them into remission, recovery, etc.
Yes, I agree totally, and I want to underline that this quality of life of this cancer patient is important not only for patients but the relatives, because they live together with them, and it's very important for especially young and adults cancer patients. So I think that this topic will be developed during the years.
Well, this is a fantastic conversation. I know we could go on and on. I'm struck by the fact that, as we begin to talk, you just realize we're colleagues, even though you all are operating in difficult circumstances. The care of patients, the concern that you show, the interdisciplinary work that you're doing, the need for trials and research, all of that is just common to our community. So we are always struck by the courage and compassion that you all show under difficult circumstances. We're so grateful that you took the time to join us today. For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.
Free audio post-production by alphonic.com.